antibiotics, glycopeptide antibiotics, oxazolidinones, and polypeptide antibiotics. So in lincosamide antibiotics, we have the drug clindamycin. Its mechanism of action, it inhibits protein synthesis by binding to 50S ribosomes. The oral absorption of clindamycin is good. It penetrates into most skeletal and soft tissues, but not in brain and CSF. The half-life of clindamycin is 3 hours. Uses, it is restricted to anaerobic and mixed infections due to its potential toxicity. The bacterium fragilis causing abdominal, pelvic and lung abscesses. It is the first line drug in this condition. Clindamycin can be used in skin and soft tissue infections to patients allergic to penicillin. It has also been employed for prophylaxis of endocarditis in penicillin allergic patients. The side effects of clindamycin are rashes, urticaria, abdominal pain, diarrhea, pseudomembranous enterocolitis. Now, glycopeptide antibiotics. In this class, we have the drug vancomycin. It acts by inhibiting bacterial cell wall synthesis. The bactericidal action is exerted only on gram-positive cocci, Clostridia, and diphtheroids. This drug is resistant to methicillin and most other antibiotics as well. It is not absorbed orally, so given by IV administration. It is excreted unchanged by glomerular filtration. The half-life is 6 hours. Uses, orally it is used in pseudomembranous enterocolitis and staphylococcal enterocolitis. And by IV, it is used in MRSA infection. It is the most effective drug in MRSA, skin, soft tissue and skeletal infections. It is also used in empirical therapy of bacterial meningitis. Here, the vancomycin is combined with IV ceftriaxone. Vancomycin is the preferred surgical prophylactic in MRSA prevalent areas and in penicillin allergic patients. Toxicity of vancomycin can cause concentration dependent nerve deafness, kidney damage, skin allergy, and fall in BP. It causes Redman syndrome. In Redman syndrome, the rapid IV injection causes chills, fever, urticaria, and intense flushing. Oxazolidinones. In this, we have linezolid. Mechanism of action, protein synthesis inhibitor. It binds to 23S fraction of 50S ribosome. It stops protein synthesis before it starts. It is rapidly and completely absorbed orally. Half-life is 5 hours. It is primarily bacteriostatic but can exert cidal action against streptococci, pneumococci, and bacterium fragilis. Uses, it can be used orally or by IV administration in skin, soft tissue infections, hospital-acquired pneumonia, MRSA, some VRSA. Being bacteriostatic, it is not suitable for treatment of enterococcal endocarditis. Linezolid is used as a reserve drug for extensively drug-resistant TB. Side effects: mild abdominal pain, nausea, diarrhea, thrombocytopenia, neutropenia, and anemia after prolonged use. Optic and peripheral neuropathy if given for more than 4 weeks. Serotonin syndrome. It occurs when linezolid was given to patient taking serotonergic drugs like selective serotonin reuptake inhibitors because it is a weak monoamine oxidase inhibitor. Polypeptide antibiotics. In this, we have polymyxin B and colistin. Mechanism of action, bactericidal agents, detergent-like action on cell membrane. Due to high affinity for phospholipid, the peptide molecule orient between phospholipid and protein films in gram-negative bacterial cell membrane causing distortion or pseudopore formation. These antibiotics may also inactivate the bacterial endotoxin. Mechanism of action, there is no cross resistance with any other antimicrobial agent. Uses, topically it is used in skin infections, burn, otitis externa, conjunctivitis, corneal ulcer caused by gram-negative bacteria. Orally, gram-negative bacillary diarrhea, especially in infants and children, Pseudomonas superinfection enteritis. Adverse effect, No absorption can occur from oral route. It causes GIT side effects like occasional diarrhea, vomiting, and nausea. Bacitracin. It is active against gram-positive organisms. Mechanism of action. It is a cell wall synthesis inhibitor. Increases efflux of ions by binding to cell membrane. Bactericidal. It is not absorbed orally. It is not given parenterally because of high toxicity. Use is restricted to topical application for infected wounds, ulcer, eye infection. Bacitracin does not penetrate intact skin, therefore it is of little value in boils, carbuncle. Now MCQs. Which is the first line drug used in Bacterium fragilis causing abdominal, pelvic and lung abscess? Linezolid, bacitracin, clindamycin or vancomycin? So the answer is clindamycin. Toxicity of which antibiotic causes red man syndrome? Vancomycin, clindamycin, aminoglycoside, tetracycline. So the answer is vancomycin. Vancomycin shows all side effects except red man syndrome, skin allergy, fall in BP, serotonin syndrome. Serotonin syndrome. It is caused by linezolid. Which antibiotic show detergent-like action on cell membrane? Polymyxin B, colistin, bacitracin, linezolid. So polymyxin B and colistin. Which is a protein synthesis inhibitor? Linezolid, bacitracin, vancomycin, beta-lactams. The answer is bacitracin. Thank you.